Hi, sir. How worried are you about how sustainable our healthcare system is? How sustainable do you think our healthcare system is?
Canadians need to have health care. It's a right.
Yeah.
And that's all there is to it.
Do you think we can sustain this into the future?
Yes.
Yeah. And you, sir?
Love it.
Yeah?
Love it.
Okay, thank you very much. In Canada, about $200 billion a year is spent on healthcare annually. Young people should rightfully be wondering how sustainable the system is and what will be left for them when they need that care. So if you don't know what we are about, we are a group devoted to citizen engagement. What we want to do is break that very polite Canadian taboo of not talking politics at the dinner table. Because if we don't talk about politics, we never discuss the issues. We don't really ever get past that 30-second soundbite that you get on TV.
So why should you care? Well, I'll tell you a bunch of reasons. Like I said, first of all, depending on your age, you're going to be affected by the inability of society to pay for the demand of services of healthcare that are going to be needed, or your children, or your parents, if it's sandwich generation, or even yourself. So that's a big one. So we should all be vested interest in that as members of civil society.
The purpose of Medicare was to make sure that doctors got paid. That was the focus of the healthcare system. It was a focus around doctors. It wasn't a focus around health.
It seems like at some point the government is going to be out of money to keep financing the system. So actually I think that the system should be not only public but probably a mix between public and private.
So to me, if you leave here with one thing, to me the heart of all of this, the sustainability of our health system, is the system we have was designed for the needs of the population in the post-war era, which was, it used to be you got an infection and you died. So we designed a system, which we call an acute care system or a sick care system, to fix you and heal you so you don't die from pretty basic avoidable stuff, heart attacks, car accidents, right?
Do you think it's going to be there for you when you get to older age?
It's not entirely clear, to be honest, but I hope it will.
You hope it will?
Yeah.
What kind of things do you think we can do to make sure it does?
Well, I think we need to rationalize the healthcare system in terms of services. So, in other words, we think we need to try to make the delivery services as efficient as possible.
The biggest driver of the dramatic growth in health care costs has been drug costs. It has not been doctors' costs, it has not been hospital costs, it has been the cost of drugs. And that's that's basically a monopoly. I mean, the companies get patents. They're able to keep them for, I think, 20 years, and then they change them slightly and try and get another 20 years.
I think when it comes to prescription medication, then it gets extremely unaffordable and it's not covered by a lot of our healthcare. So that's a little bit scary if you don't have benefits, right? So hopefully there's more jobs with benefits or unionized jobs with benefits, but that doesn't seem to be the case, right?
Do you think we can pay for everybody to have a very high standard of care? Can we afford it?
Yeah, it should be, yeah, for sure, but we just got to put our money in the right places.
Yeah. So do you think it's higher taxes or?
Just spending the taxes more wisely.
I don't think the solution is to keep increasing the amount of money that we spend. We need to start spending it smarter.
Yeah.
And I think everybody agrees with that. But politically, it's very difficult to do because healthcare, as most of you know, is a provincial responsibility, and Flaherty doesn't have the constitutional authority to say how the money actually should be spent.
What kind of policies can move us toward better healthcare sustainability?
I think it requires a question of political will. It also requires a readiness to restructure major parts of the healthcare system. When we look at seniors, for example, we have to get seniors out of nursing homes and out of hospitals and into the community. Not only is it more humane, but it's dramatically cheaper. We need to get away from a doctor-centered form of healthcare so that people do preventive services, physios, massage, naturopaths. They all have an important role to play, but they're incredibly marginalized in our present system because our system is focused on making sure that doctors get paid, and that's not the way, that shouldn't be the central focus of our healthcare system.
And so for a young person who might be concerned about some of these issues, what do you think they can do?
What I'd be excited about as a young person is the proliferation of innovation. This system is desperate for innovation. We're not going to get innovation from the old thinking and the old companies and the old health systems. It's going to be the new guys, the young guys who are going to think differently, start up a company, start up a social enterprise, thinking about the business of aging and what new companies, services, products they can bring to that with a fresh pair of eyes. So I actually see a lot of opportunity for our young generation to be an agent to actually fix our health system.
What I learned out of this event was to really read up a little bit more on the Canada Health Act and also understand a little bit more about my local community health options. I'm starting to think about my parents now as they age, and there was a lot of good discussion on that this evening.
Make sure that your politicians know that this is a priority to you and all Canadians. If you have any good topic suggestions for next time, tweet us at WSIC_Canada or send us an email at salon@whyshouldicare.ca. We'll see you soon.